Hi, this is Dr. Jason Piquel, and what I want to go over today is that there is hope. There are solutions for people with neuropathy despite what your doctor has told you. Now, commonly I get the question, what are these new options? And the thoughts that I hear or things that people tell me is they basically say I have to take my medications, but they have these side effects and they really aren't even helping me. And then there's other patients who just say, hey, there's really nothing else for me to do. I just have to live with it. And basically, my doctors have given me all my options. So over the last several years, there's been more and more information about how nutrition and certain types of therapies can help neuropathy. The big myth that exists right now is only people with diabetes get neuropathy. And of course, this is totally wrong. There's many causes for neuropathy, and we're going to talk about them because it's all not just related to blood sugar. Now, as you already probably know, peripheral neuropathy is a problem with the nerves, and these nerves, they carry information to and from the brain. So again, a nerve in your foot or your hand or even in your toes, it's basically like a telephone line or an electrical line. And again, these nerves, that's where we sense pain. And so if they get damaged, we can get chronic pain, we can lose sensation in the feet, you could just lose complete feeling in your foot. And of course, what does that do? It also, those messengers to your muscles that tell them when to contract stop working. So now your muscles can actually start to weaken. So when we say the word peripheral, that means beyond the brain and beyond the spinal cord. These are all the nerves, of course, that go into the extremities, into other areas of the body outside of the brain and spinal cord. Neuro in the word neuropathy means nerve, and then the end of neuropathy, that word pathy, that means either abnormal, disease, damage, dysfunctional. So basically what the word neuropathy means is these nerves are damaged and they're not working. Now, just because you have symptoms in your hands and feet, that doesn't always mean that the cause of the problem is there. Now, sometimes it can be, but again, sometimes it can be in other areas. This is why the diagnosis and treatment, they go wrong so many times right from the very beginning. The doctor only looks at the foot or only looks at the hand, and they miss the whole picture. So in our recovery program for neuropathy, the most important thing is it's unique. It's like nothing you've probably ever done. We don't consider it only a diabetic problem, or for some people and patients that we have a multiple sclerosis problem, which both can damage nerves. What we find is it's a neurological, hormonal, immune system, sometimes a toxicity issue, or sometimes even a nutritional issue. Our treatment philosophy, which is so important to me, is treat the person, not the diagnosis. Oftentimes, if you have numbness in your foot or you can't feel the feet or you're getting burning down there and the doctor diagnoses you with neuropathy, the first thing that he does is he goes into his book and he opens up to the page of neuropathy and says, what are the 5 things we can do? Again, you can't do that. Each person is different. We have to find out, what is the mechanism? Why is this happening in your case? There's no one-size-fits-all recipe. This is a good thing for you. You need to be looked at as you, not as everybody who has this label or diagnosis. Again, one cause for neuropathy that we see a lot is what's called an autoimmune attack. And again, this is where the immune system, your own immune system, starts to attack your nerves. There's an outer layer of the nerves called myelin. It's kind of like a fatty insulation, and this is where some of the electrical impulses travel down. And again, this can be damaged in a bad way. And again, this is not normal to have, but things that can provoke this, some people have food sensitivities, where every time they eat a food that creates inflammation in the body, their immune system attacks that food protein, and suddenly that sparks off a cascade of events, and now my immune system is attacking my nerves. Some people have viruses and infections that they don't know about, that don't show up on the typical labs, and their doctors don't run the other labs. We see many people with heavy metal toxicities, mercury, lead, things that you've been exposed to over time. In fact, when it comes to mercury and aluminum, these are some of the things that are found the most today in the research with Alzheimer's. Again, this affects the nerve tissue and, of course, can also affect neuropathy. Also, high amounts of insulin. This doesn't mean you have to have diabetes, but you could be getting insulin spikes if your blood sugar goes up and down, and insulin becomes inflammatory, and again, that can cause nerve damage. Also, high amounts of inflammation. If you've got a fire burning in the house due to certain conditions, that fire can cause a lot of destruction, and that fire is called inflammation. And of course, these last two, insulin and inflammation, they can really be affected so much by, of course, some people with blood sugar dysregulation. And again, like I said, you don't have to be diabetic or even be diagnosed with a blood sugar problem to have a real blood sugar dysregulation. You could have a roller coaster in blood sugar called dysglycemia. You could have reactive hypoglycemia. There can be so many other factors going on that doctors don't diagnose that could lead to your problem. Now, as a matter of fact, research shows that diabetics and non-diabetics with insulin resistance, often called prediabetes, have just as many damaged nerves as diabetics do. Now, this isn't good. This is confirmed by biopsy. What they did is they took tissue samples in people who weren't diagnosed with diabetes. They just had insulin resistance, or they were getting some symptoms. And so again, this can go undetected for years, whether you feel it or not. Probably the most common things I'll hear with this are, Dr. Backel, I feel tired after I eat. Or Dr. Backel, after I eat, I just crave something sweet. Yet these are these early signs and symptoms. So that's why we have to look at your blood work, and we can't just look at it from a pathological standpoint. When we look at blood work, we also look at it functionally. So if something's at a 28 or a 29 and it takes a 30 to be positive on the blood test, let's not just ignore it. Let's say, hey, this is approaching a problem, because your lab ranges are based on a bell curve of each lab. And of course, not many healthy people get their blood drawn every day, so you may not look too bad till you get really bad. And why wait? So what really makes our program unique? Number one, we use functional neurology, which I'm going to explain more. Functional endocrinology, which involves all your glands, your hormones. Functional blood chemistry, like I was just talking about. We look at your blood from a different perspective. Functional medicine, which I'm sure you've heard of, very much on the rise, involves looking at the body not just from a disease standpoint, but catching it before it gets there. And functional toxicology, looking for these heavy metals, these chemicals, other things that can store up in the body and cause problems. Now we look at all these things I've been talking about, and what we'll find is they can produce weaknesses in your brain, in your immune system. Blood sugar and insulin levels can be skewed, can cause issues with your hormones. And again, you may have a toxic load, which again involves, do you have heavy metals in your system over time? If you were exposed to leaded gas, you may have an issue there. Of course, they don't have leaded gas anymore. Again, or if you were exposed to certain farm pesticides or herbicides, a lot of things can cause a lot of problems. So we look for all of these possible causes. We don't waste time. We know how to help all of these. Instead of one piece at a time, wasting months and years going from doctor to doctor, each of which, these doctors, they just look at you through a different set of blinders. If you go into the neurologist and they look at your nerves, and then if you say, hey, my stomach's bothering me, they're going to say, well, don't tell me that. Go to the endocrinologist. Everybody's going to look at you in a separate set of blinders. And so, but the thing is we've got to take a step back and say, wait, could all this be connected? So again, like I said, we've got to look at the whole picture. And most specialists, which that's what you see the most of, they don't really take a step back and they don't say, hey, you know, you've got this problem, but what's really going on here? What's behind it all? Oftentimes it's just, hey, here's the medication, and they send you on your way. So the difference is I ask that question. This is not a one-size-fits-all treatment. You know, my approach is actually very simple. Number one, I identify the areas of the brain or of the nervous system that are not functioning correctly. And then we strengthen them and help them to heal through non-drug methods. We identify imbalances in the immune system, any hormonal issues, any blood sugar balancing. We get rid of those toxic loads. And we can do this through so many things, but a couple of things that really work well are proper nutritional supplementation and then homeopathic treatment, which is amazing at helping some chronic issues. Now, when we look at the brain itself, because remember, all those nerves in your feet, they start in the brain. So you may be feeling pain in your foot, or you may be feeling numb in your foot. But what's the consequence where that electrical line or telephone line, those nerves, connect into your brain? And again, is the problem coming from the brain itself a functional issue? Because the parietal lobe in your brain, that's your sensory area, and it's got a map of everywhere in your body. So if that map isn't working correctly, that can cause problems. And a lot of people end up never getting better because that's never addressed. And again, we've got to look at these areas. If that parietal lobe starts to slow down or weaken, we've got to identify that and help fix it. So when you start to get numbness, if you start to get tingling, burning, pain, these are early signs that the nerves are damaged, that the nerves are having problems. And of course, that will just worsen. And again, because of these connections to the brain, we can use both the brain and certain nerves to help change things. The signals that travel through your nerves, it's like signals in a radio. And again, when you're feeling the burning, the numbness, and the pain, that's like static. It's like you don't have that dial tuned in just right. So when you tune it in properly, things can start to change. So again, with that weak parietal lobe, we can get the same things: numbness, tingling, pins and needles, burning, weakness, pain. We have to look at the brain area as an option, and yes, it can be changed. What does the brain need for healing? What do the nerves need to heal? They need oxygen and regulated blood sugar. Those are called fuel. Those are the only two types of fuel that our body needs. It's like gas in the car. Also, our nervous system needs activation. It needs to be stimulated properly. Those nerves have to have regular stimulation. And even exercise at a certain point is very helpful to the brain and the body. Another important factor here is insulin is inflammatory. If your insulin is spiking, your blood sugar is swinging, not good for your brain. Even in non-diabetic patients, insulin can be toxic to your nerves and can destroy them. In non-diabetic patients, you can still get insulin resistance. We have to look at those functional ranges on your blood work. And remember, two big signs of that are I'm craving sweets after meals or I'm feeling tired after meals. Inflammation. Again, inflammation is a big danger sign. You know, it really can mess up your blood sugar. It can be worsened by a hormone called cortisol, which is also a regulator of blood sugar. Inflammation can be triggered by these heavy metals, these environmental toxins, these things that you may have been exposed to over years and years that have accumulated in your system. Tons of research on that. And again, round and round we go. You know, it's this vicious cycle of just different things just stoking the fire of inflammation. So first of all, I spoke about oxygen. Now again, our oxygen levels, because we need oxygen for nerve healing. Our posture can affect that, certain spinal movements, certain anemias. There's different things that we have to look for. This is one component. If oxygen levels aren't right, your nerves aren't going to heal. You know, it's important to know that even after age 20, we lose our ability to utilize oxygen by 1% per year. So again, over time, like I said, if you're age 47, you've lost 27% of your capacity. So again, do you think you're getting much fuel to where you need it to go for healing? Also, our program is important because it actually increases oxygenation. We can use oxygen concentrators. We can monitor your oxygen levels. We can affect some of the postural changes that affect your ability to breathe properly and get oxygen. We can look at your blood and say, hey, is there something missing here that could be decreasing your oxygen even more? A lot of things that a lot of your doctors miss or don't even really take the time to look at. Again, what are your traditional treatment options? And again, I've highlighted a few of these here, some different medications, different things. The problem is none of these really help the cause of the problem. And there's even more drugs than this. I just put a few on here. The problem is like I was saying, the medications, none of them work to correct the root problem. What they're doing is they may turn off the pain signal or decrease the pain signal, but none of them are helping the nerves heal. My job is to get your body functioning better. My goal is not to get you off your medications, but it's hopefully to get you to the point where you may not need all of them. Now, again, doing nothing is what most people end up doing after they go into their doctor. Because again, you've tried all the medications and they didn't work. Then you're told, sorry, too bad for you. You know, I mean, you're just going to have to live with this thing the best that you can. As far as surgery, you know, there's no effective surgery for neuropathy. There's nothing that works in that direction. What's missing? You know, the thing is we have to find out what's causing the problems. Most doctors don't do this. Most doctors don't consider that area called the parietal lobe in the brain that we see oftenly affected. Most doctors don't consider an autoimmune issue attacking the nerves. Most doctors don't consider blood sugar regulation unless there's diabetes, which even if there is diabetes, there's things that can be done that your doctor typically isn't doing from a nutritional standpoint. And doctors never, ever, or rarely consider toxins, heavy metals, infections, things like that. They just aren't even looking at those things. So again, we have to use certain therapies to turn on the brain, to get the brain going, to get the nervous system going. And I've highlighted some of these here. We use what's called brain-based or nervous system-based treatment. We have to stimulate that parietal lobe of the brain, and we have to stimulate the central nervous system, and we also have to stimulate the damaged peripheral nerves. So let's look at the whole nervous system, not just some nerves in your toes. One way we do this is in most of our patients we have to make dietary changes. Many people with neuropathy are not eating very well and probably haven't eaten well for some time. So again, we can show you exactly how to eat correctly for your particular condition. And not meaning we have to take all the yummy stuff away, but it is important. We've got to do things that don't promote or eat things that don't promote inflammation, especially during the time while you're trying to heal. Another very important thing is I had to go through the research and I had to find what supplementation can be used for neuropathy. What are things that can be used to directly help nerves to heal? And there are so many things that no doctors ever use or even research. Another really amazing treatment that we use is a laser. This laser helps nerves to heal, helps decrease inflammation, does so many things, painless, very comfortable. therapy. Lasers are state of the art right now, and the research is just pouring out on the different things that lasers can do. But with neuropathy, I found so many amazing results from laser. Another very important treatment modality that we use is this electronic neurostimulation, a special type of electronic stimulation that helps to stimulate healing in nerves. Amazing, again, amazing therapy. It's not painful. You don't have to have injections of anything. It's very comfortable. Most people are sitting in a chair or laying down and they end up falling asleep through the whole thing. Again, we've got to do everything possible to get the nerves to heal. Also, there's home therapies, things that you'll do at home. This is an example of one. There's so many different things that we have to have you also doing at home to continue the treatment, continue the therapy, keep you getting better at a rapid pace. So again, what we're going to do is when you initially contact us is we're going to look at a comprehensive questionnaire that I'm going to give you, because I've got to find out more about you, more about what is causing your problem. Then we're going to go through some different tests if we need to find out what exactly is causing your neuropathy. Again, so many more things. So many things that your doctors typically have never even looked at. Also, we have office visits with in-office treatment, which I was showing you a moment ago. We have home therapies, reevaluations and retesting, because that's the thing is I've got to make sure you are getting better. You could come in and say, you know, Dr. Piquel, hey, the numbness is less, or I'm feeling better, or I'm walking better, or my balance is better. And don't get me wrong, I'll believe you, but I've got to see these changes. I've got to be able to measure these changes. So important. So I truly know that you're getting better and you're getting lasting results. Also, diet and lifestyle changes. You have to be willing to change or you're not bad enough. My patients, they are suffering enough. They're feeling lousy all the time. They're willing to change their diet, to change their lifestyle in order to get better. If you want to get your neuropathy better, but you still smoke cigarettes every day, sorry, it's not going to happen. Again, also our specific supplementation program, we are going to use specific things, again, to help change the physiology, to help these nerves to heal. Now, what we'll do is we'll schedule a proper evaluation and look at all those factors we just talked about. We start with a consultation where you come in and you get to sit down with me, and we're going to perform this comprehensive review. We're going to talk about your health. We're going to talk about you from a global standpoint, not just, hey, are your feet numb? No, we've got to look at every aspect. We've got to use anything we can to our advantage that we can use to get you better. We take our philosophy very seriously and treat our patients with the highest expectations. We don't settle for minimums, and we expect the maximum. Results? Well, our program has extremely high success rates. Now, this is due partly to my unique approach, but also to our comprehensive screening process. I only accept cases that I believe I can help. Now, the thing is on a daily basis here at the office, we demonstrate that functional neurology, functional endocrinology, functional medicine, these things, they're working wonders in improving performance of the human body. Now, I've got a few questions for you. How has your neuropathy affected your relationships? How's it affected your family? How's it affected your finances and your other activities? Number 2, what has it cost you in time, money, happiness, sleep? And a very important question, where do you picture yourself in 1 to 3 years if this problem's not taken care of soon? I mean, if you're watching this, you probably have quite a few years left in your life. And again, how do you want to live it? And also, what is it worth to you if we could improve your condition? If we could change this and you could get your life, or not only get your life back, but also maintain independence. So this is very important because there's 3 factors that I have to determine when you come in. Number 1, what's causing your case of neuropathy? Like I said, we've got to find out what is affecting you. Just because you've been given the diagnosis of neuropathy, or maybe even haven't had that yet. Again, if they've given you the diagnosis, you don't fit in the box with everybody who has neuropathy. You could have different causes than everybody else. I don't want to just treat the diagnosis. I want to treat you. Number 2, how much nerve damage do you have? This is very important for me to know. And number 3, what treatment and how much treatment does your condition need? And again, once I find out the answers to these questions, I can sit down with you and we'll go over all the specifics, because it's very important that we're on the same page and you know exactly what to expect. You know exactly how this all works. Very important thing relating to that past question about nerve damage, because I have to tell you this right now. If you've already sustained more than 85% nerve damage or loss, I might not be able to help you. And again, we can determine that here in the office and find out what percent. And that's, like I said, I have to screen. I have to make sure that I can help you, because I'm not going to give you false hope. I'm not going to say can help you when I can't. So we have to get that out of the way right here, right now. So what's your next step? Number 1, go ahead and call us here at the office. Schedule what we call a case review. And what we'll do is we'll send you an information packet. And then you'll get that information filled out, get that back to us so I can look at all your information before you come in. I can already know you to a big degree before you come in, and that way we can spend our time not asking you 1,000 questions, but finding out, number 1, can I help you? And if I can, what can I do for you? Like I said, we have to find out if you qualify for our program, and I have to find out if I'm going to accept your case. I believe that every person has the unlimited potential to improve the quality of their life. Yet more than anything else, I believe in restoring hope one person at a time. There may be an answer for your neuropathy, and I'll see you soon.